How's it going, guys? Past level question for pathology for step 1. 61-year-old woman. She has an abdominal mass removed, high capillary density on biopsy, 814 translocation. There's elevated vascular endothelial growth factor, VEGF. Question wants to know the diagnosis and the reason for the elevated VEGF. So 814 translocation, past level Burkitt lymphoma. It can be 2-8 or 822, but 814 is going to be 19 out of 20 times. Burkitt can be intra-abdominal or a jaw lesion, increased risk with EBV. Biopsy would show starry sky appearance, so background of B cells with translucent macrophages that are called tingible, not tangible, tingible-bodied macrophages, which have apoptosis as the process they undergo, which that's a question on the NBME exams. If an arrow pointing to one of the macrophages and starry sky appearance, the answer is apoptosis. C-MYC gene, C-MYC, it's a transcription factor. That's the gene associated with Burkitt. And then follicular lymphoma, 1418 translocation, BCL2 gene. It's an anti-apoptotic molecule. It's the most common indolent non-Hodgkin lymphoma. It's going to present as a waxing, waning neck mass over the course of a couple of years. Mantle cell lymphoma, garbage for USMLE. It's 1114 translocation. Maybe one question in history where it actually shows up. Okay, so this is Burkitt, or abdominal lesion 814, as we already said. And then the question is, holy shit, well, VEGF is increased. And what's that mean in terms of PO2 and CO2? Well, even if you're not sure, I've seen students get tripped up on this. If you have increased cellular growth, but we originally have the same blood flow to that organ/tissue, well, wouldn't that cause focal/localized hypoxia at the site of that increased cell growth? So initially, we're going to have decreased PO2, aren't we? So that's our correct answer here. And that decreased PO2 is going to stimulate the release of vascular endothelial growth factor, which is why we get angiogenesis with tumorigenesis. Okay, so it's a past level detail. They ask it on one of the offline NBME exams. They make it easier. They're just like, person has an abdominal tumor and VEGF is increased. Why was VEGF increased? And the answer was just decreased PO2. And they had other bizarre answers like thrombostatin, or thromboplastin, endostatin, etc. You have students choosing weird answers never heard of before in their entire lives. I've said, if you don't know an answer, don't choose weird sounding shit. Okay, so your take home here: Burkitt lymphoma, 814 translocation, and then decreased focal PO2 is why VEGF will be stimulated for tumorigenesis. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.